Lauren Brown, and a big thank you to the moderators that do most of the work, Sandra Grassa and Lorianne Slahwhite. So thank you guys very much. I'm going to do a little housekeeping, and then I'm going to pass over the mic and the PowerPoint to Debra and Zena. I just want to let you know this is our Community Unity lecture series. They're free to come for the live webinars. So today being February 17, 2021, as we record this, this is the lecture we have now. We have another one on Monday with Kate Levett. So check that out. You can sign up for that free link. And you can also see the CEU PDA approved live webinars that happen on the weekend. These Community Unity Immunity lectures, they run approximately an hour. There's no CEUs for them. They're just for the love of learning. And then we do have CEU courses through the Healthy Seminar site. If you missed one of these live webinars, I just want to let you know that we do have a community site, a community library where you can go and watch these after the fact. And so I don't think I have it up on my thing to bring up for you. I'll just let you know that if you follow the link after the fact, it will take you to the community library. What we've done is we've archived from the past 10 years. So back when we had the Medagogy free site, all the past Community Unity Immunity lectures we've done in Healthy Seminars and Pro-D, all those lectures have been put into the library. And for the subscription, you can access all those past lectures. And then everything we do now, like today's lecture, after the live webinar, that's where this will get archived. I do want to let you know that it's the Healthy Seminars Chinese New Year sale. You can save 30% off. And so that's on all recorded on-demand CEU PDA approved courses. It doesn't count for the live webinars. And so if you go to the Chinese New Year sale, you'll see tons of information regarding the live, regarding the on-demand recorded courses. Debra Betts and Claudia Citkovitz and Zena Kocher and Kate Levett and Sarah Budd have a mentorship program. It's been a dream that I've wanted to do on Healthy for many years, and we've built another site for this. It's available through the Healthy Seminars. The idea is in health professions, most of them have kind of a mentorship. There's this opportunity, a residency, where you can get the experience from senior doctors, experienced doctors. In the Chinese medicine profession up until now, and predominantly, we graduate and we go out on our own without that support, that mentorship, and we get usually the most difficult cases, right? That's what kind of comes to us. And so with gratitude, I'm excited that this group of incredible acupuncturists, Debra, Claudia, Zena, Kate, and Sarah, have come together and created a mentorship program where you get peer support. So you get to support each other through the forums and discussion. And you also get case study and learning opportunities through these clinically experienced practitioners. This starts March 1st. That's our start date. So if you go to the mentorship program, you can learn more. It runs about 10 months. It's online. There's courses for you to watch inside the mentorship. And then there's office hours where you get to connect with the teachers, and also they have guest TAs that come in to support you. And it's all around using acupuncture in pregnancy, birth, and postpartum care. One other thing I want to let you know that's happening in Healthy Seminars is the ICCM 2021 is online this year, the Israeli Congress. And we're feeling fortunate as well that Healthy Seminars is offering 2 of their bundles this year, and they're on sale right now through the Healthy Seminars website. And again, best of luck to the ICCM. We're really excited for them to have that presence and to use Healthy Seminars as one of their online platforms to offer their bundles to speakers. We're doing the neck and shoulder disorders. We chose that topic because really, if you can treat neck pain and shoulder pain, upper trap pain, that's all you need to treat, and your practice would be full. And so we got 5 experts. Susan Johnson's going to talk about the Master Dong. Pony Chong's going to talk about neuromeridian acupuncture. Tom Bizio on sport medicine. Adi Fromm is going to talk about the balance method, and Arya Nielsen on Gua Sha. And then we have an insomnia bundle. Sharon Weisenbaum is going to talk about classical herbs. Hamid Montakov is going to talk about classical acupuncture approach using the divergent 8 extra channels for insomnia. Lori Deschard, many of you know Lori Deschard, is going to talk about her acupuncture approach for treating insomnia. Yvonne Farrell shares her Jeffrey Yuen approach and her approach using the 8 extras and all the extraordinary meridians for treating insomnia. And then Jonathan Shubbs is going to talk about the balance method as well for insomnia. So I just want to let you know that that's available now as well. Reminding you for today that this is for educational purposes only. This is not intended to be medical advice, so this should not be interpreted as medical advice. Again, this is for educational purposes only. If you have a health condition, please seek out a healthcare provider. Now, let's bring up the PowerPoint presentation for Debra and Zena, and let's get Debra to share that or to take control of that. I'm going to pass the torch over to Debra. There is Q&A here, guys, so please post your questions, comments in the chat room. Again, Sandra Lorianne will moderate those for the Q&A with Debra and Zena. And Debra and Zena, hopefully you'll both give yourselves a little bit of an introduction. So some people may be new to you, to each of you, and let them know just kind of who they're listening to today. So I'm going to pass the Zoom controls over to Zena over in New Zealand. All right, go for it, Debra.
Hi, everyone. Great to see so many people here from so many different places of the world in these times where we can connect in this way. It's quite exciting, despite what else is going on around the world. So I wanted to, again, acknowledge Lorne and Sandro and Lorianne and the team for making all of this possible. And really this for me to be able to work with my colleagues, Claudia, Zena, Kate Levett, and Sarah Budd in terms of our MAMPS program. So Lorne has always supported us in this, and we've been running this for several years now, refining it slightly, and it's really exciting to be able to come together as a community of acupuncturists that are passionate about bringing acupuncture into the pregnancy health field and share our ideas and have interesting discussions. And this is really what the framework I want to look at these forbidden points through. So just a little bit, just checking that the PowerPoint works. In a second. I'm having trouble with the, here we go. So I just wanted to say, I think there's a time lag, I think. Right. I just wanted to say that I'm not a midwife. Some people sort of have that impression, but I have worked with midwives as part of my nursing career when I was an intensive care nurse, neonatal intensive care nurse. And so rushing down to all these births and assisting with the babies. In terms of my acupuncture training in London, when I returned to New Zealand, led me working with midwives and looking at the preventative side of pregnancy and what acupuncture could provide to that, which led to the book, a hospital clinic, undertaking a PhD eventually because of my interest in answering the research questions, and at the moment doing a lot of online work, including the mentoring program that we're running with colleagues, as we said, with Claudia Citkovitz, Sarah Budd, Zena Kocher, and Kate Levett. And so that's part of what I wanted to highlight is how productive it can be to work as a team and also look at what we can share and bring back to the community. So this is entitled The Forbidden Points because I think this is the foundation of feeling confident about pregnancy treatment, is that to be able to answer questions around what is safe to use in pregnancy and what is effective to use in pregnancy. And for whatever reason, the idea that there are these forbidden points keeps coming up, and I would like to just dismantle them and come back and look at them through a different framework, that there are, what do we need to be cautious about in pregnancy? And when we use acupuncture points, what's our rationale for using the points that we use? And getting rid of that term forbidden points. And really about having a discussion about what do these points that we've all been told about, what do they actually mean for our professional practice today? And part of this framework, to me, I think how it's helpful to think of it is this kind of idea of a three-legged stool that you're building your practice on. And I want to look at it today through the lens of how do you interpret knowledge that's valuable for you into your clinical practice. I think this is something we do all the time. And we're looking at this idea that you have what you learned from your teachers, what you gain from your colleagues, And certainly that's a really valuable way of getting information. And then we all interpret it and about what we take into our practice from that. We've also got this idea that you're interpreting your patient's experiences. So our patients come to us and we translate that into how we're going to incorporate that into their diagnosis, how we're going to talk to them about the diet and lifestyle, information, criteria, and homework we're going to give them. And we're always, I think, interpreting our patients' experiences so that that becomes part of our treatment and how we approach our care to them. I think that's just slightly different from Western medicine that tends to come in and talk to their patients about what they need to do to get healthy, whereas we're actually taking their tongue and their pulse and how they feel about this and asking them about their symptoms and interpreting that into our diagnosis. I think that's a really valuable part of what we do. And something that I also think of as the third leg of the stool is actually what is in the literature. And that can be historical, what's in the historical literature, and what is also in the research literature that we can interpret as useful for our practice. And that to me, sometimes I feel that for some practitioners, that's a little bit of a missing or a little bit of a wonky edge to their stool, that they're really confident about the knowledge that they had from their education and the knowledge they get from lectures, like these online lectures and talking to their colleagues, and they're really confident about interpreting their clinical information, but it's what is actually there in the research literature or the historical literature that perhaps would make people feel a little bit more confident. And one of the things certainly that I would suggest is that when you're talking to Western medicine practitioners, they have those three legs. They may have different information about what their teachers taught them, and they may interpret their patients' experiences differently with their Western lens on, but they feel very solid about what is in the literature. And often I think that that is somewhere that I have an advantage when I'm talking to Western medicine practitioners, because I can also discuss that with them. So what I wanted to do was run through this in terms of the forbidden points. What historically were these? Where did they come from? And if you look at the literature, early on, they were talked about as points for difficult labor. You had points that were there for difficult labor. There were some warnings about using acupuncture historically, and there were some warnings about some points. I'll look at those. And then we come into when I was trained in the late 1970s, there were these lists of things that you shouldn't do that were forbidden. And there's different lists around all over the place from different schools and different teachers. And there was some induction research that said that acupuncture could induce labor. And that sort of set up this idea of it being dangerous, and possibly you could induce premature labor if you use the wrong points. And then we got the rise of medical acupuncture in the literature. And what they were talking about was that forbidden points are just a bit of witchy stuff that comes from traditional doctrine, and you don't need to worry about it. So I want to just take us through that and look at that in a bit more detail. So these are some texts where you have specific points mentioned, but they weren't mentioned as these are forbidden in pregnancy or you should never do these in pregnancy. These were points that were for difficult labor. So the context of this was that women had been in labor, they were being attended by the midwives or the woman around them. Things were not going well. They had to call somebody in desperation. So they called in the practitioner and they rushed in and they did heroic medicine. They tried to save the day. And Charlotte Firth writes about this very nicely. They were practitioners of heroic medicine. Things were dire, and they had to try and do something. And that's where you get the stories of being able to do things like large intestine 4 or spleen 10 or gallbladder 21 and saving the day. And some of those stories are fairly sad, I must say. But that is what you find in the historical literature, is this heroic last-ditch attempt medicine when things were not going well. And they reported fantastically points that we still see as valuable today to use in labor. I just think that's so interesting, that all of these points are things that we would also think about using for a difficult labor. And the bladder 67 was with the moxibustion. They were trying to make the babies move. So that, to me, has a slightly different feel to it. And you did have historically, and some of you would have seen the lectures, had the great fortune to do with the wonderful Sabina Wilms, who's translated some Meow's work. There were warnings about doing points for each specific month. And that was because in that month, for example, the first month, the liver meridian was supporting the pregnancy. So it was like, don't muck around with liver energy in the first month, because that is supporting the pregnancy. And what they said was, for each month, it's the transporting shu points and the front mu and the back shu point. I talked about interpretation for clinical practice. So for me, that interprets as if the liver meridian is supporting the pregnancy and you've got liver heat or liver stagnation, I will treat that because I want the liver meridian, I want that liver energy to be optimal. And so I see it as being an awareness that historically there were different meridians coming into play as the pregnancy progresses. Keep those in harmony rather than them being forbidden. So that's how I use those points. And there's a lot of interesting things in there about how they were tracking a pregnancy and visualizing a pregnancy and visualizing health in a pregnancy. But that's a whole nother lecture. But I think that historically it was very important to nurture pregnancy and produce healthy children in Chinese medicine.